Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. Governor Sununu and Dr. Benjamin Chan, the state epidemiologist, gave new updates about the state's response on the COVID-19 outbreak. Here is what Sununu said during that news conference today. That news conference happened around 3 p.m. today. Sununu warns domestic violence, child abuse may be unreported during stay-at-home order. More funding provided for support services for victims. With reports of domestic violence and child abuse down during New Hampshire's stay-at-home order, Governor Chris Sununu announced new funding Wednesday to support victims, saying the incidents are still occurring. Statewide domestic violence hotline is 800-277-5570. DCYF Child Abuse Hotline and website 800-894-5533 and nowantedtell.org. The governor said some people might be particularly vulnerable while they stay home as much as possible to slow the spread of COVID-19. Sununu said a $600,000 fund would be created to ensure that sexual assault and domestic violence crisis centers have the resources they need to help victims. Funds can also be used for hotel rooms because shelters are at or near capacity. More than $2 million will go to the Division of Child, Youth, and Families, Sununu said. The money will help pay for counselors and staffing phone lines, along with implementing technologies such as video calls for site visits. Sununu said anyone who has concerned about an adult who might be in danger or who is experiencing violence can call the statewide hotline at 800-277-5570 to be connected with local resources. The DCYF hotline to report child abuse can be reached at 800-894-5533. Sununu said it's staffed 24 hours a day, 7 days a week. Reports can also be made online at knowandtell.org. One death in New Hampshire attributed to COVID-19. Other deaths could be linked, officials say. That is what Dr. Benjamin Chan, state epidemiologist, announced during the news conference today. More deaths, hospitalizations investigated as possible cases of COVID-19. Another death in New Hampshire has been linked to COVID-19, and health officials said more deaths are being investigated as possible cases. Dr. Benjamin Chan, the state epidemiologist, said Wednesday that 4 people are confirmed to have died in New Hampshire of complications related to COVID-19. He said there are other recent deaths that might also be linked to the coronavirus. Chan said other people in New Hampshire hospitals might also have COVID-19. There have been 59 confirmed cases that have required hospitalizations, he said. A total of 415 COVID-19 cases have been confirmed in the state, with about 6,400 people tested for the virus. Chan said he believes that COVID-19 is widespread in New Hampshire and presents in most communities throughout the state. He said many people with mild symptoms might not have been tested but could still spread the illness to others. Chan said the peak of infections in New Hampshire is still likely weeks away, even as infections decline. There could be weeks or months of precautions necessary to help ensure that the virus does not spread quickly. Chan said Granite Staters should continue to practice social distancing and remain at least 6 feet away from others when performing necessary tasks outside the home, such as grocery shopping or buying gas. He said frequent hand washing and disinfection of surfaces can help prevent the spread of the virus. And that does it for my evening news report right here on the Riley King Network. I hope you all have a wonderful rest of your evening. Thank you for watching, and I'll see you back here tomorrow with more news reports. Good night and bye, everyone.